Hi, my name is Dr. Chandra, and today I want to talk to you about a very important subject. March 1st is the National Awareness Day for Non-Suicidal Self-Injury Behavior, NSSI. In simple or layman's terms, NSSI is when people resort to self-harm with no intention of suicide. It's very, very prevalent, and actually more prevalent than most people might imagine. If we take a census, they say in the general population about 20% of adolescents have indulged in NSSI at some points. So NSSI is defined as deliberate and self-inflicted destruction of one's body tissue without the intention of suicide. So cutting, burning, piercing, scratching, these are some examples. And it's especially prevalent in the adolescent population, and it's most commonly associated with a very high level of psychopathology. So if you think about it, the average teenager is not going to indulge in this behavior. It's only those who have very deep-rooted, long-standing issues in the mental health arena that resort to this behavior. So if we said, who are the people who typically do the self-injury? It's adolescents and young adults. The onset typically is around 13 to 14 years of age. It's especially common in those prone to self-criticism and those that have self-directed negative emotions. The person typically either has problems with themselves, their problem-solving skills, or there's interpersonal conflict, and this individual who indulges in the self-injury is just not good with coping skills, and they have some impulsivity, and that's how they end up indulging in this behavior. Sometimes they say they have self-directed anger, or they do it as a form of self-punishment. And it's interesting if you really study it and say, why are they doing this behavior? So there are a few different reasons. One, as we said, was self-punishment. The other is they feel as if it gives them a sense of control. So think about an individual who's going through a lot of pain or trauma, and those painful thoughts come to them at random times, and it's totally beyond their control. But when they indulge in the self-injury behavior, they get this sense of control that they can do it at their choosing when they want to. Another thing, if you talk to these young adults, they'll tell you that the physical pain in some ways overpowers the emotional pain, and therefore they feel a sense of relief from the emotional pain that they have been carrying for a very, very long time. So what's the relationship between the self-injury and the suicidal behaviors? So typically, people who are doing the self-injury do not intend to be suicidal. However, if the self-injurious behavior continues for a very long time, it can become a predictor of future suicide. So if you're somebody who is suspecting, say, a classmate or a friend may be doing the self-injury behavior, what are some of the clues that can help you pick up on this behavior? So if you see that the individual suddenly has a change in mood, their grades are dropping, they are withdrawing themselves, they are not coming to social events, or if they have scratches and they have no good explanation for it, or if they are suddenly wearing very long sleeve clothes and clothes not typical of this individual because they're attempting to hide their scratch or cutting marks. And if you find out that your friend is having the self-injurious behavior, what can you do to help that person? First and foremost, please be supportive and not judgmental. Talk to them, encourage them to get professional help. Because, as I said, most people who are doing the self-injury have deep-rooted, long-standing emotional issues, including depression, anxiety, and a lot of PTSD. So self-injury behavior patients require a long treatment lots and lots of counseling and medicines, and it's best to refer them to a specialist. Thank you.